Hello, it's Anthony Chadwick from the Webinar Vet. A slightly croaky one. Apologies, I've got a little bit of a cold at the moment. We're really pleased to welcome you to this Webinar VETchat podcast. And I'm really honoured to have Cecilia Villaverde on the line today. Cecilia is a diplomat in veterinary nutrition. And we've got Cecilia on today because really interested to have a chat with her. But also this month in October, our focus for the month has been all around obesity. And you will have seen a course on the site, which is well worth looking at. We're also partnering on this whole theme of obesity with Mars Pet Healthcare as well. And so today we're going to be talking mainly about obesity. But before we kind of roll into that, Cecilia, first of all, encantado. We
Encantada.
will be carrying on the rest of the webinar in English. I think it would be really painful for mainly Spanish people to listen to me trying to speak Spanish, particularly with the gruff voice as well. But it's great to have you on and, welcome. But maybe just before we start on that whole topic of obesity, just tell us a little bit about how you got involved in the whole area of nutrition. What made you become a vet? Just to give us a little bit of a background.
That's a big question. Yeah, I graduated a while ago now in 2000. We last weekend we just did our 25th year reunion in Barcelona. It was really fun. I know. I think I always liked animals and I always wanted to help. I think like most of us have a similar story. And when I was in vet school, I was very interested in nutrition as, it's the building blocks of our bodies and of all our functions. And I also really like math. So nutrition kind of incorporates a lot of math into it. And after vet school, I did a PhD with chickens, but in nutrition. And then I did move to California to switch so I could go back to small animals. And then I did a postdoc there, and then I did a residency training in small animal clinical nutrition. And I've been boarded in the American and European College since 2010 now. So most of my work now is help other vets with their complicated nutrition cases, if they need help choosing a diet or a homemade diet formulation.
Mm.
And I do enjoy working with a lot of different specialties. Like I work with internists, with dermatologists, with critical care people, because everybody eats, so nutrition is
Mm.
important for all areas of vet med. So I do enjoy my work.
I think it's an interesting area because as a student, I used to go to a practice in Accrington and I'd see all these fat Labradors coming in. And we had a food at the time called Leo Pet Food for obesity.
Hmm.
And the sales, what the vet would be chatting, and he'd say, "Oh, and Anthony wants to chat about obesity at the end," which was always
Hmm.
quite nice to do. And I'd then get them on the diet. Now, obviously, I was only there for a short period, but during the time I was at the practice, the obesity sales would like go like that through the roof
Hmm.
because I just used to think you've got this fat Labrador that's coming in with arthritis. Of course, we can treat it with non-steroidals, but actually, if I can only do one thing, if I get 2 or 3 kilograms off that dog, it's going to do probably a lot better than give it, you know, anti-inflammatories, but not really
Absolutely.
address the weight. It's interesting, and I don't know what your thoughts are. Are we getting better as vets because we like to treat ill animals? We like to get those animals better.
Hmm.
Nutrition is very much around prevention, if we get that right.
Yeah.
And then obviously if we have a problem, we've got so many beautiful, really great prescription diets now. But what's your feeling? You've obviously dedicated your life, to nutrition, and I think it is such an important area. And as you say, it brings all of the areas together. Even dermatology, which was my special interest. How do you think we're getting on? Is that something we're now thinking more and more as vets? Diet, before we go on, to try antibiotics, steroids, etc. Are we thinking about diet more and more now?
I think so. I do have the
Yeah,
feeling that we're doing better nutrition wise. I think that's a lot driven by the caregivers as well, because we're
yeah,
more and more worried about how we feed ourselves. So they are also wanting us to talk more about nutrition. And I think like especially for enteropathies, I think there's a big push
Mm.
to focus on diet rather than antibiotics, and a lot of the pets will respond to diet if we
Yeah.
don't give up. So I do think we're doing better in that regard. Regarding weight management, overweight, and obesity, I don't know that we're doing that much better just because the prevalence of the problem doesn't seem to be going down. So
Yeah.
it feels like we could be doing better to help people manage the weight of their pets from the beginning. Like obesity and overweight is one of those conditions that, even though it's simple in concept, is extremely complicated in
Yes.
practice. So prevention is way better than treatment. But that implies that we need to talk to our clients about nutrition from the first visit.
Yeah.
And we don't need not to be afraid to discuss nutrition, which can be a fraught topic. But we need to talk about nutrition, and we need to give them tips and information on how to maintain their pet at a healthy weight. It's just because treatment, it can be successful, but it often isn't. And
Mm.
it's just miserable all around. So I think we could do better in that regard for sure.
Those fat cells that you grow as a puppy, obviously also a kitten in that first year of life,
Hmm.
you never, my understanding when I was looking at it was that you don't lose fat cells, you just make them bigger or smaller. Is that still
Hmm.
right?
Yeah, that's still the thinking. So if you're overweight as a puppy, you have more
Yeah.
adipocytes, not just bigger adipocytes. But even if you have a non overweight puppy or a non overweight kitten, if they grow too fast, they
Yeah.
have a higher risk of becoming overweight at an adult age. And this is a work that was done, of course, by Alex German and a lot of the people at Waltham too. So it's not only focusing on the overweight while they're a puppy or a kitten, but also on their growth rate.
Yeah.
We can do a lot of good things if we communicate to caregivers once they get their puppy or their kitten, and we give them all of their puppy kits or kitten kits. Also include a growth chart in there so they can plot the weight on that chart and ensure they don't grow too slow or too fast. So that's one of the things that we have more recent that we could be incorporating more.
I used to love the growth charts, following those, particularly the bigger dogs, the
Hmm.
Labradors and so on. And sometimes, holding them back a bit, even if they were below the chart, was better than them being above the chart because they could always catch up as well. But that monthly visit with the help of the vet nurse, I think also really gets the animal, gets the client bonded with the practice as well, doesn't it?
Absolutely. And everybody likes, to see their, I think, the individualized growth of their pet.
Yeah.
And those newer charts that we have, like they're very easy to use. And basically, it's not that you are below or above the chart, but you just need a particular growth
Yes.
pattern is what's important. You don't
Yeah.
want them to grow maximally. Some pet caregivers might be worried that their big dog's not going to be as big, but it's just going to take longer. It's just going to take a year and a half instead of a year. They're going to get there. But a lot of people don't know that we have those tools
Yeah.
for them. So,
I think condition scoring is also important because when you see a Labrador, and I know I'm going on about Labradors, but they do
I mean,
have
they're
their
a poster
issues with
child. Yeah.
obesity, and you see one that I look at and say, "Oh my goodness, that dog is in such good condition." A lot of people, obviously pet owners mostly, would say, "Oh, it's underweight, it's skinny, and therefore want to put
Hmm.
weight on it." So it's just being able to kind of educate people into condition scoring as well, isn't it? And what looks right. Have you got any advice for vets how we can
Absolutely.
incorporate that into, and nurses, of course, in consults?
Yeah. Yeah. So this is very true, I think, especially because sometimes we see them on those dog shows that are shown on TV, and we've seen some winners that are definitely
Yeah,
not at the right weight, and
yeah,
the perception of what a healthy Labrador, to follow your example, looks like might be bigger than we would like it. So I would say for vet clinics and everybody at the vet clinic, like having the body conditions chart on the walls
mhm,
and pictures of different breeds of dogs at their ideal weight so people can start seeing. And then when you talk about their pet, if you have examples of their breed, so we can start accustoming or getting them used to maybe it
yeah,
should be a bit thinner. Like, but people really. feel a bit scared and they might get talked in the dog park that their dog is too thin. I have been given money for an appointment because the dog was too thin and the dog was perfect. So I think the vet team is needs to be equipped by those images, like the
Yeah,
body condition score, teaching their client how to do body condition scoring from early on, having pictures of different dogs, showing them like how the ribs should feel, how the waist should feel, like from the beginning since they're little, and then every visit just reinforce it, because you need your clients to do this at home. Like they're not going to be visiting you often enough
yeah.
for you to catch any drifts. So getting a weight, getting a body condition, and having your clients know how to do it and know what their pet should look like. That's important, and that's a role that vet clinics should be fulfilling.
It's always good to get puppies and kittens in regularly, if nothing else, just for a cuddle.
Absolutely.
You know, for the vets and the nurses to be able to cuddle. This is part of the
Absolutely.
reason why we became vets, isn't it? We like to
Yes.
cuddle dogs and cats. It's good for our stress levels. The stroking.
Yeah, I only have cats at home, so it's very nice when I get dogs in the clinic.
Yeah,
I
yeah.
get my dog cuddles.
Well, obviously, we're talking about obesity there, but also if you are growing, and I'll go back to the Labrador again.
Mhm.
You're growing that Labrador too quickly. Of course, we think that then they're much more prone to orthopedic problems as well,
Mhm.
don't we? Like elbow and knee and hip problems as well.
Yes.
So, what's the sort of most up to date work on that? What are we seeing, and how can we prevent that? Obviously, partly genetic through breeding, but then where does diet come in? Is that kind of getting them to the weight at 18 months rather than 12, as you just discussed
Yeah,
before?
there's two big nutritional factors that can affect the appearance of orthopedic disease. One of them, probably the less important one, is calcium, and the other most important one is energy. So we
Calories.
know giving them too much calcium as they're growing, especially larger breeds who are already genetically predisposed, can
Yes.
result in joint and bone issues.
Yeah.
And they're genetically predisposed the way we have selected for them. Their bone quality is not as great. They have thinner cortices, thinner bone, like weaker bone, really. So if they grow too fast when they're puppies, there's a big development of the muscle and the organs, but the bones are not growing at the same rate. So you have this sort of decompensated growth and you're applying too much biomechanical pressure. So that's where energy comes in. So if I give them too much energy, they're going to be growing too fast. There's going to be a higher biomechanical stress on
Yeah.
the joints. And then this genetic predisposition is actually seen clinically in practice. And it's been a while now since we know that if we grow them slower and if we grow them to be more a body condition score of 4 out of 9 rather than a 6 out of 9, which would be the typical Labrador, they're going to be having a lower prevalence of hip dysplasia and other joint issues. And even when they're older, like when they're 8, 9, 10 years old, the severity and the incidence or prevalence of osteoarthritis is also going to be lower. They're
Mm.
going to have less osteoarthritis and they're going to have it less severe compared to pets that grew too fast as they were puppies or they were too heavy um, during their whole lives. So keeping your dog, large breed dog, lean from the beginning till the end can do wonders for the quality of life because joint disease, as you know, is can be terrible on quality of life. And in that same study, they also found that these dogs lived 2 years longer,
Yeah.
which as an intervention, tell me what else can we do in veterinary medicine to get that kind of result. And then of course Alex German and their team, they've done a lot of good work on even other breeds, smaller dogs, medium dog breeds. If they're overweight, they do have a shorter lifespan.
Yeah.
So I would say, as hard as it is keeping our pets lean, it just gives us better time and longer time with them.
The joint thing is often we see that with diets now, with large breed dogs, that the calcium levels in those diets are lower than in, maybe a Yorkshire Terrier or a Jack Russell Terrier. Is that still right as well?
Yeah, on a percentage basis, there's a safer percentage for larger dogs.
Yeah.
Smaller and medium breed dogs can get away with a lot. But with a large and giant breed, you need to be very careful because they have a lot of bone. They do need a lot
Yes.
of calcium, but they're more sensitive to excess calcium. The regulatory system to handle excess dietary calcium is very immature and not working that
Yeah.
well. So if you give them more calcium in the diet, more is going to be absorbed. That can interfere with ossification, right?
Yeah.
So you need to formulate diets that are really carefully designed to provide all the calcium that they need but not go over it, so it's like a narrower range of safety. So for me it's super important when you have a large breed giant breed puppy. It's always important, but more for them, to choose a diet from a manufacturer that has the science and the expertise to be formulating such a precise diet.
Yeah. I remember, again, early on in my career, where breeders would actually feed bone meal to those big dogs because they
Hmm.
wanted them to grow quicker and their bones to get
Yeah,
quicker,
that
which,
feels horrifying.
yeah, it sounds sort of sensible that, they've got a lot of bone, so therefore they need more calcium. But of course, it's a negative feedback and it really
Hmm.
screws them up. Do you still see cases where people are
I do.
adding bone meal into diet, or is that kind of myth now being debunked?
Yeah. I don't know if bone meal, but calcium supplements are still very
Yeah,
popular. And if you go online and look at the stores, there still are sold to that on
yeah.
top of a puppy diet. And you see then trouble because you're just interfering with their normal ossification. I think it's less frequent than before, thankfully, but I still see it. And it's just people that are not aware of this risk of giving too much calcium. Yeah.
I think this is part of the problem of, obviously a certain percentage of the pet population come to vets and a certain percentage never come. Obviously,
Hmm.
we get a decent percentage coming for the first vaccination, but then we might not see them again. So how do we, as a profession and as a pet food industry, how do we get that messaging out better? Because I'm not sure I see a lot of adverts going out, to pet owners individually that is saying,
Hmm.
you've really got to watch because you will see, obesity is an issue and we don't want this. And obviously, calcium as well. How do we get those messages
Yeah.
across? What are your thoughts?
That's such a good question. I don't know that I have the right answer,
Yeah.
but you need to meet people where they are. And, we as a profession are doing our best with the clients that come to us. And we have our puppy visits, our kitten visits, and, your yearly wellness exam,
Yeah.
where you do all this communication. But probably we could get some help from, maybe companies that have more money than we do,
Yeah.
and do more of, I mean, like what you're doing right now, like this obesity awareness month, or you can also have one for growth, right? And have more of a campaign in different areas. Like younger people are more on different social media apps,
Yeah.
older people are in different social media apps or on TV. Like when I watch TV, I only see commercials for like old people, like your
Yes.
funeral
Yeah.
and your
Yeah.
will and things like that. So we probably could do better. Like I'm not 100% sure I know how, but definitely we should
Mm.
be meeting people where they hang out. And I guess today that's more social media. But I think vet clinics are kind of overwhelmed with our day-to-day job
Yeah.
to to do that. So maybe organize vet organization or vet nurse organizations should be taking the lead on that.
I think the nurses are, I have this huge regard for nurses in the profession.
Invaluable to
We
us.
can do so
Invaluable.
much, can't we, with the veterinary nurses? And maybe we, in practice, they're not always utilized and
Leveraged, right? Yeah.
leveraged as well as they could be because, again, quite often people will come out of a veterinary consult and say, well, can you repeat what he said and or she said in plain English, Spanish, Italian?
Hmm.
The nurse can really act as that conduit and spend more time with the client
Absolutely.
as
Like
well.
translate some of the things, reinforce the message,
Yeah.
spend more
Yeah.
time. And I think they trust the nurses more sometimes with some
Yes.
information, including nutrition. So you definitely, I think, if vet clinics leverage their nurse team or vet
Yeah.
techs or however you call them in your part of the world. For nutrition, I think they are our best tool.
Yeah.
Especially depending on the length of the appointment. You need to put a lot of information in a wellness appointment or a puppy visit, and nurses can definitely reinforce, translate, follow up better.
Yes. So we've obviously talked a lot about prevention, and prevention is always better than cure. But What are you sort of 3 or 4 tips? And I know I've kind of talked a lot about Labradors, so maybe I'll talk about another breed. You know, a Rottweiler comes in, overweight. How are we more likely to have success with that client? You know, what are the 2 or 3 things that we could do that would make a real difference?
Yeah, I guess before we get into treatment, I would like to say like a little bit more thing on prevention, and it relates to your comment about Labradors and
Yeah,
Rottweiler,
yeah,
is that some of your dogs or your cats are going to be more at risk than others. So I think we as a our veterinary team should be doing customized weight management plans for every pet that comes in, just looking at your risk factors for overweight,
yeah,
right? If you do your nutritional assessment, you will identify some animal factors like it is a Labrador or a Greyhound, like same size
yeah,
dog. It is really hard to see an overweight Greyhound. It's almost as hard to see a lean Labrador, right?
yeah,
So breed, age, middle age kind of disease,
mm,
neuter. Right? We know
yeah,
that neuter predisposes to overweight. So those pets are going to get a different diet plan that if I'm dealing with a young Greyhound that's very active and is intact, right? So, and also take into account other factors external to the animal, like the feeding method or the diet choice or the activity level. So, we can give also advice on look, this type of dog that you have should be exercising this number of minutes per week. A lot of the kennel clubs have recommendations on that. You can also tell people about portion control. You can talk to
yes,
people about treats, etc. Like I
yeah,
usually recommend that treats are maximum 10% of the daily calories, and they might need a little bit of help with that math and trying to find some lower calorie treats. Um, like for example, dental treats are really useful for dental health, but can be really high calories. So within those, you can try to find something that's lower calorie in an at-risk dog or cat, right? So I would say that would be my big prevention spiel, how you want to call it. It's do your nutritional assessment, identify risk factors, and then give a feeding plan recommendation, customized or tailor made to the risk that that dog or cat has for overweight, like diet choice, daily allowance, and feeding method, right? But sometimes this is going to fail, and then
mm,
we're going to run into that overweight Rottweiler that comes into your clinic, right? If that happens, usually what I would think about is first you need to diagnose this dog with overweight using your body condition score chart, communicating that to your client, and then your client has to want to first recognize that the dog is overweight, which is not easy, and second want to act and fix
yeah,
it. And I don't know what your experience is, but that for me is the hardest step.
mm, definitely.
Yeah. So when we talk to our clients about that, that's why I think it helps if you bring nutrition up in every appointment, even if it's for 3 minutes, and teach them BCS, body condition scoring from the beginning. Then, you can mention, look, here's the body condition score chart. Here's where your dog sits. And he is over what we would like. And the reason this is concerning to me is because this is associated to a shorter lifespan or the appearance or worsening or certain diseases. So if we want to keep, fluffy, healthy for as long as possible, I recommend that we address this. Not everybody's ready to hear that or ready to act on that, and that's okay. In my mind, at least, you put your little seed, they might come back a few months later when they're ready to have the discussion. And when they're ready, then I will start with a plan. Like I've learned the hard way that if they're not ready and then I push them into a weight loss plan, it's going to be a failure.
Doesn't work. Yeah,
I mean, they're the ones who buy the food, they're the ones who have a thumb, are going to be opening the bags. If they're not ready to do it or they don't have the mental bandwidth to deal with it, not going to happen. So that would be my first advice is sound them out, bring up the
yeah,
topic. No judgment. No, this it is really hard to be an ideal BCS, especially with some
yeah.
breeds. Some breeds are always hungry. They might have some joint disease. They cannot really exercise that much. There's a lot of reasons why they might be overweight, and I don't want to blame anybody here for that. I just want to fix it, right?
And sometimes that may be a medical condition. So obviously,
Absolutely.
within obesity, of course, we can start by trying to reduce weight. But if weight is not coming off, that dog could be hypothyroid, or the cat could
Hmm.
have diabetes or whatever, couldn't it?
Exactly. There's endocrine diseases that make it hard. And even like some breed idiosyncrasies, like we know that Labradors are just hungry all the time and it's hard to resist.
Yeah,
Some dogs are just like if you compare a Newfoundland with a Great Dane, for example, right? Similar
yeah,
sized dogs. The Great Dane easily needs twice as many calories as a Newfoundland even though they're literally the same size. It's just
yeah.
because its body composition is leaner. So it's much harder to keep a Newfoundland on an ideal weight compared to if you have a Great Dane. There's nothing morally wrong with you. It's just that it's
Yeah.
harder with some pets, right?
And Great Danes don't swim in the Atlantic Ocean catchment
Exactly. They
strip.
don't need that
They
that
don't need
protection of
protection,
subcutaneous fat. Yeah.
insulation.
Exactly.
Yeah,
Exactly. They need that fat to do their job when you're Newfoundland,
yeah,
right? So, yeah, so there's a lot of reasons why a pet might be overweight. It's a multifactorial condition with environmental and genetic factors. So, it's not necessarily anybody's fault that your pet is overweight. I'm just communicating that they're overweight and what can we do about it. But definitely cats can also be overweight. Like the
yeah.
prevalence is not that different from dogs. So, everything that we said also applies to them.
Do you think also cats now more and more, maybe indoor cats rather than outdoor, that must also affect
Yeah,
through?
definitely a risk factor for overweighting cats is their housing.
Yeah,
So cats that have access to the outdoors have less of a risk, probably because we assume they can exercise more and are more active.
yeah,
Might be hunting, and indoor cats might not be getting the same degree of exercise for sure. So it depends a lot on the geography of where you are. Like now
mm,
in Ireland, I see cats are more indoor outdoor. When I used to live in Barcelona, they're not outdoor that often. Like it's more of a
sure.
dangerous place outside. So, but definitely all of those things will affect the risk of overweight.
So with indoor cats, I've heard it's even more important to play with them because playing will obviously also help with the calorie.
Yeah. And not only for the calories, also for their brain
Yeah,
stimulation. Like there's lots of things to do outside that they don't get to do inside.
yeah.
So there's a lot of play behavior with them is very important. As a bonus, it will help your weight management as well.
I also find that cats are very mindful because Budgie will sit outside and just stare at a bush for half an hour. And there is no way I could stare at a bush just for half an hour and not do anything. But the mindfulness of dogs and cats, they teach us lessons, don't they?
I wish I could. Yes.
Yeah,
Like I cannot stay for 3 minutes without my brain thinking about something else.
yeah, yeah. I talk a little bit about that. That fat Rottweiler that comes
Mhm.
in. And let's say the client is at least open and
Open
has
to it.
accepted that. When you've said she is carrying a little bit of extra weight. What is the few tips that you can give us that perhaps will help us in managing these sometimes intractable cases?
Yeah. They are hard. Like everybody out there, it's not your fault. Like
Mm,
treating obesity is hard. Main reason it is hard is because the body will fight you. The dog's body or the cat's body will adapt and decrease the metabolic rate once you drop the calories. So
mm,
treatment, as I said, it's simple in concept, complicated in execution. But if you have an overweight pet, basically what's happening is more calories are coming in than are coming out. Okay,
yeah,
that doesn't mean that the calories coming in are a lot. As I said, a lot of our pets are super thrifty, and even with a little more, they already become overweight, right? So our job is to turn that balance upside down, right? We're going to drop the calories in and increase the calories out. So exercise is very important, of course, in without getting the dog or the cat a problem. Like you don't want them to blow their cruise shit. So
mm,
if you do exercise, it has to be moderate and
yeah,
safe. But calorie wise is never going to make much of a difference. So you do have to calorie restrict. So that's the treatment of obesity. Very simple. I'm going to feed you less. I'm going to feed you fewer calories. Easier said than done. But when you do that, there is an adaptation of the body to drop the calories that are expended. That's because this is sensed as a threat to life, right? There's a
yeah,
body system that will regulate your body weight. It doesn't work that great to prevent overweight because honestly, that could be a positive for a future famine, right?
yeah,
And those are the dogs and cats that have survived, those that have survived your periods of famine after the feast, right? But when you're losing weight, that is a threat to life. So they're going to fight it. So it's going to be really hard. That's why everybody is frustrated with treating obesity, vets, vet nurses, caregivers alike, right?
Mm.
So first thing we're going to need to do is to feed fewer calories, feed less. So for that, it's best if you know what they're feeding right now. If you can get a good diet history, then you drop that by 20-30%. That's a good way to know you're feeding fewer calories. If you have no idea what the pet is eating right now, outdoor cat, multiple pets eating from the same bowls, family members giving a lot of treats. Sometimes it's impossible, then you have to estimate it with a formula that has a lot of error. So, my first tip would be if you can, get a good diet history. That helps. Second thing you need to decide is what do I give this dog? What do I give this Rottweiler that's a bit chubby? You can lose weight with any diet, but it's not necessarily a good idea. Like, as long as the calorie balance is negative, you can lose the weight. However, if you use the same diet and just tell them to feed less of the same diet, which is an advice that I see often, you're not only going to be dropping the calories, you're also going to be dropping the protein, the vitamins, the
Yeah.
minerals. Am I making sense? Because when you
Yeah.
make a diet for maintenance, you make sure that all the nutrients are there when you're maintaining your calorie intake. When you drop it below what the label says or below what they're eating, you can run into nutritional issues. And probably protein will be the one most concerning, because if you're losing weight but not getting enough protein, you're going to be losing more muscle than you should. And then that's going to predispose you to regain all the weight again. So that's why I do like to place them on a weight loss diet, a prescription therapeutic, however you want to call them, because they're high in protein and fortified in all of those other nutrients, besides being low calorie and bulky to make the dog or the cat feel more sated. So a lot of these diets are high fiber, so this Rottweiler doesn't feel like eating everybody in the house when you're
Mm.
dropping the calories. So it helps them feel more full. But the main reason I like them is because it's safe. It's safer. I'm providing all the nutrients that they need. There's many brands that use different strategies to achieve this, like lower in fat, higher in fiber, moisture. Wet foods for cats for me are lifesaver for weight loss. Cats seem to feel more sated with a wet food than with a dry food. And then it's also harder to screw up the measure, right? A lot of people don't have a scale at home or don't want to use it. And for dry food, they will use the cups, which are terribly, terribly imprecise. So for dry food, I would always recommend you use the scale. For the wet food, is easier, right? You give a pouch or half a can. Like, it's harder to give more calories than you want to give. So diet choice would be, for me, if I can use a weight loss diet, I love it. Like, bulkier, safer. And then also it signifies that this is a process with a beginning and with an end, right? At some point we will be done with this and maybe we can
Yes.
switch to a different diet. And some people like this sort of, okay, yeah, this is not forever. You're not going to be in a limbo.
Mm.
The thing is for me to tell, I know for veterinary healthcare teams, for people who have pets, the diet is not magical, right? Sometimes I will get clients that say, I put him on this diet and didn't lose weight. So the diet failed. Said that's the calories, right? The
Mm.
diet is not what's going to make you lose weight. The diet is going to help you do this safely. But don't put all of your hopes in just switching the diet. You still need to drop the calories.
And sometimes with that sort of client, when you actually delve, they're still feeding the tidbits, which and the treats, which obviously look small in size, but often are quite calorie dense, aren't they?
Yeah, let's talk about treats, because I always try to incorporate them into my plan. Always, because no one's stopping them, right?
Yes.
If you are a person who likes to give treats and your pet enjoys receiving the treats, I don't think I know how to stop that behavior. And I only try if it's like a food allergic dog or a cat. And even then, I try to find something because it's nice. Like, it's a nice way to strengthen our bond with our pets. Some pets do need behavioral modification or training, and you're going to be using treats and tidbits for that. So what I usually tell people is we're going to include this. We're just going to do 90% of the calories from the main diet and then 10% for fun. Okay? That
Okay.
90%, I'm assuming that most companies have this 10% margin of safety. So the rest of the 10% is for your unbalanced items. Remember, it's not only the treats or the toppers or the snacks. Some supplements might be calorie providing, like some oils. Some medications might be flavored and some supplements might be flavored and also provide calories. Like some
Mm.
of those chews that some joint supplements have might have like 40 calories each, like which is considerable, right? So anything that's not the complete diet goes into your 10%. And then it's here you can give some guidance on what. Like if we do things like cucumber or melon, like you can give way more than if I'm giving peanut butter, right? So, I mean, sometimes they want to give the peanut butter, okay, but you're just going to give a little bit. And as I was mentioning, some of the dental treats can be pretty high in calories, but I know some brands now are having dental treats with the dental benefits, but also lower in calorie. So when you're doing a weight loss plan, maybe go towards those treats.
And it's also with any animal, any pet, it's often there may be two or three issues. So if those teeth are becoming more dirty, then using something like a dentist stick would be really good
Absolutely.
because that's helping the teeth. And as you say, you've got to then reduce the amount of the general diet that you're giving because of the potential calories of them.
Yeah, definitely. And I think the Dentastix Lite is now a thing, and it has about between a half and two-thirds of the calories of a regular Dentastix.
Yeah.
So that is nicer because then you can fit it into that 10%. And of course, for dental care, we want them to brush their teeth, but you also want other home care strategies if you want to use them.
Brushing a Rottweiler's teeth can be
Yeah, it might be more
challenging.
difficult.
I came through 25 years, 26 years of being a vet and still have uh,
All of your fingers. Good job.
8 fingers and two thumbs. So I feel like I've been successful in life.
Yes, yes, for sure. Like, I mean, my cats, I always end up adopting senior old cats that don't want me to brush them. But
Hmm.
if you have a kitten or puppy, it's a good moment to get them used to the brush because it
Yeah.
is a dangerous area for your hands, that's for sure.
I think garden gloves are always useful if you're trying the Buddy is the same. He's not keen and he lets you do a bit and then he suddenly tries to attack the brush. You know that you've had your moments.
Yeah, put your treats into your plan, but just make sure you count those calories as well.
Cecilia, it's been really good talking about this. And obviously, we need you on again because we've really just talked about one topic. I'm sure we could talk about kidney disease. I'm sure we could talk about
Anything, yes.
dermatology. I mean, I could definitely keep you on for a long time talking about dermatology and food trials because it's
Oof, yes.
the number of times, I had a referral and the vet would say the dog cat is on a food trial. And I used to have great fun in just saying to the client, okay, what is your pet on? And they may say hypoallergenic diet by Royal Canin or whatever. And then I'd say, and what else? And they'd go, well, he gets a little bit of toast last thing at night.
It's
And
insane.
we give him the Sunday roast. But, anything that we don't do, Sunday
Yes.
roast, he sits at the table. He won't leave us until we've given him a bit of beef and a bit of potato and a bit of carrot. And
Oh,
so you see this food trial disappearing, and I'm sure that must be a little bane of your life to finish with,
it's the bane of my
just trying to get
existence,
people to be
yes.
so strict on a diet. But can he still have this? No, no. If it doesn't come out of this bag and it's not water, he can't have it.
And it still happens. It still
Yes,
happens.
even when we've spent 20 minutes explaining it. So it's
Yeah.
hard for somebody who's maybe only got 10 or 15 minutes to. But this is, again is
Yeah.
where the nurse
But
can
it's
come.
also a waste of time and money for everybody involved. Like these people are
Yeah,
making an effort to buy an expensive food, and I feel
yeah,
really bad for them in that regard.
yeah.
So I do need to work on my communication skills, I think, for sure.
I think we all do, and I think talking to them, but then sending written instructions or an email
Absolutely.
back is so
Yes.
important with all of these conditions, isn't it?
Absolutely. And for weight as well. Just they need
Yeah, of course.
specific recommendation in writing. I would say we need to encourage, like if I had to say something before we finish, talk about nutrition with your clients from day one. Give them their
Yeah,
tools, give them the body condition score, give them their growth charts so they can handle that. So your clients have the tools to deal with the weight of their pet, have them weigh their pet regularly. Having a scale in your reception without them having to go for a visit can be super helpful for them to get weighs in, especially for dogs. Weigh the food if they can, and control those treats. And if you're dealing with a weight loss plan, your follow up is going to be essential. So get those dogs back, get that Rottweiler back in for weigh in so you can adjust the food.
Yeah.
And a lot of cheerleading along the way. Like, we know that losing weight is hard. It is hard and it's difficult, and we need to support our clients throughout the whole process
Mm.
because it is hard.
But
But
getting
you know,
that, but getting that 2 to 3 to 4 kilograms off that Rottweiler, the client will probably notice a difference in just in its willingness
yes,
to walk and
yes.
do all the other things as well. So I think it is a bit of a rolling ball down a hill. At first you don't seem to make much progress, but then suddenly the
Hmm.
the the
And
speed
you will see
increases.
improvements with a little weight loss too. Like,
Yeah,
sometimes I might not get them to a 5 out of 9, but I'll get them to a 6, and it'll still be
yeah,
better than an 8, right? And as
of
you
course.
see, all of our clients say that, oh, it's more active now, feels more like a puppy, and then it reinforces that this, because it's a bit of a change in lifestyle for everybody
Yeah.
involved, right? So you need positive reinforcement and positive outcomes.
Celia, it's been really great. Thank you so much for agreeing
Thank
to
you.
come on to the podcast. It is a topic that I was very passionate about when I was in practice, because of course it's a form of malnourishment. If a dog is 20-30% overweight, we don't think of it as being malnourished, but of
Hmm.
course it is, and it affects its quality of life. And we've all come into the profession to make animal welfare and animal health better. So
Hmm.
it's a massive area, and
Yeah.
I've really enjoyed speaking to you and just
Thank you.
hearing those nuggets of wisdom that can make such a difference.
Yeah, I think we all want the same. Want our pets to be long and healthy lives. This
Yeah,
is just a bit harder to do than other things, but we can do it. I trust in our profession, and I trust in our pet caregivers that want to do the best for their pets. Um,
yeah.
so if we can support them more to do that, the better for everybody.
Thank you so much again, Celia. Thank you,
Thank you.
Cecilia. Thank you so much to Mars Pet Healthcare for promoting and sponsoring and partnering with us on this obesity theme that we've been holding this month.
Absolutely.
If you're listening to it after October, do look out for the course. I'm sure we can put some of the URLs underneath the podcast, and also where you can get in contact with Cecilia at Pet Expert Nutrition to discuss any cases, not just obesity cases. But yeah, it's been great having you on, Cecilia. Great for those of you listening. Thank you so much for coming on, and hopefully see you on a podcast or a webinar very soon. Take care. Bye-bye.